diseases.
Okay, so I'll be brief. Okay, I'm at UC Merced, and one advantage of being UC Merced is that for the moment I still represent all of immunology and microbiology on campus, so I don't need any diagrams to explain who is working with us. The panel of CITRIS asked me to suggest one open question related to infectious diseases that we think might be important. And I think that one topic that's related to what Regis has been presenting is inflammation and the need to detect inflammation before symptoms related to inflammation appear. So as Tom Bedinger has mentioned, high blood pressure is related to the risk of cardiovascular disease. About half of heart disease cases right now are thought maybe to be due to inflammation. So inflammation is normally due to infection. A lot of this infection can be latent. It can, without provoking overt symptoms. And many of these infections can be treated very easily. So the problem then quite often is not finding treatment for these infections, but diagnosing the infections. So I think that one an important aspect of infectious diseases then is to find ways of diagnosing the infection and inflammation before overt symptoms appear. And ideally, one should have a way of diagnosing inflammation in a non-invasive way. So there's good ways of diagnosing many infections. The problem is convincing people who are reluctant to go to the clinic to go and have themselves checked for the infection. So if there's an easy, non-invasive way of detecting inflammation, this is something that would help the field a lot. And so I would like to propose that besides looking at inflammation, one could indirectly look at the way that cells die in inflamed tissues. So this would be a generic way of detecting that something is wrong with the tissue. So there's inflammation. We don't care what is causing the inflammation, but if one could detect cells dying in a tissue, then this would tell us right away that we need maybe to draw the 10 mLs of blood to find what exactly is causing the problem. So, okay. So the infectious model system that we are working on, that we have just started a few months ago at UC Merced, is infections by an intracellular bacterium called chlamydia. So chlamydia infects epithelial cells of the eyes, of the lungs, of the genital tract. Quite often, people infected do not know that they have this infection. So in the eyes, chlamydia can cause trachoma and blindness. So this infection is overt, so there's no need for pre-symptomatic diagnosis, and it's not a major problem in the industrialized world. In countries such as the US, the strains of chlamydia that infect the lungs cause about 10% of pneumonia cases, and there is growing evidence that infection with these chlamydia increase the risk of cardiovascular disease later in life. A big problem in countries such as the US also are the sexually transmitted chlamydia. Women especially quite often do not know that they are infected, but years later they can find out that they were infected because they tried to become pregnant and they realize that they are infertile, or they have ectopic or tubal pregnancy, which is the leading pregnancy-related cause of death in the US. So, So one reason also why we are studying infections by chlamydia is that there's a good model, good animal model to study chlamydia infection, which reproduces well infections in humans. And this is the mouse model of genital tract infection. Infection in mice begins in the lower genital tract as in humans. Then the infection moves into the upper genital tract. Inflammation starts a few days after the beginning of infection. Inflammation is necessary to eliminate the infection, but at the same time, it is responsible for the scarring and the infertility due to infection. So one can see here the effects of even low levels of inflammation. This is in infected mice. We can see the damaged epithelium in mice that have a slightly higher inflammatory response. In 90% of the mice, we see obstruction of the fallopian tubes. So this is, these are clearly mice that are sterile. So what we would like to do now is to find non-invasive ways of detecting molecules that are released during the inflammatory response. One of the molecular markers that we have begun to study are changes on the surface of dying cells. Dying cells, they expose negative charges on the surface of the cells. One can measure the presence of these negative charges non-invasively using techniques such as nuclear magnetic resonance. So we can measure, for example, in vitro and with perfused organs, cells dying in the tissue due to, for example, sodium binding to these negative charges. And the mobility of sodium decreases when it binds to the dying cells. So the problem now for engineers is to help us do this with whole animals. We can begin with rodents, and the goal then in the long term would be to do this with humans.